Everybody, Dr. Carlo Oger, board certified emergency physician with Dr. If you're watching this video today, you are actually watching at ED Video Pro, a channel specifically designed for the healthcare enthusiast, whether it be student, nurse, paramedic, young doctor, or even doctor wanting to learn more, review stuff, and be a clinical astute. Hey, this here Bafford became quite famous. It's a little inside secret of emergency physicians. We call ourselves Baffords. And it stands for bad ass, the F, I'll let you imagine, and ER doctor. So we consider ourselves badasses because we handle tons of rough cases, and especially during COVID, we were primarily responsible to be in the front lines, taking care of sick people, and making some life-changing decisions. So now you know. All right, let's talk about this case. This is a 37-year-old woman who presented to the emergency department with a left lower lip pain, swelling, and rash after receiving a hyaluronic acid injection. Hyaluronic acid injection. Hyaluronic acid injection. Did I say that right? Something like that. Please forgive my second language here. It happened 4 days ago. Examination of her left outer and inner lip revealed a tender, violaceous, reticulated area in vertical distribution with pustules. After consultation with a plastic surgeon, since probably it was a plastic surgeon who put the hyaluronic injection in the first place, she received the diagnosis of vascular occlusion. Now that's pretty interesting. So let's see. There it is. You can see the redness on the inside of the lip like that. And on the outside, pustules, and almost like a triangle type shaped distribution. So let's take a good look at it again. That's what it looked like. And this happened after hyaluronic injection. So this is a vascular occlusion after injection of hyaluronic acid into the lips. During the past 30 years, dermal filler injections have been used with increasing frequency for soft tissue augmentation. One of the most commonly used injectable fillers is hyaluronic acid. Although clinically significant complications are rare, the absolute number of reported complications has increased because of increased usage. According to the American Society of Plastic Surgeons from 2014 to 2016, the majority of injections involved hyaluronic acid. 84% of all adverse events were due to the chemical. Rarely, vascular compromise can occur because of either compression of the vasculature or arterial occlusion owing to direct injection into the artery, resulting in dermatologic emergency. Symptoms include disproportionate pain and discomfort immediately or several hours after the filler treatments, blanching, and livedo pattern, that reticulated pattern with violaceous discoloration. Timely diagnosis of the arterial occlusion is important in the emergency department to prevent necrosis, that is death of the skin, and allow for full recovery. Treatment includes hyaluronidase injection, which is what our patient received, with instant reduction in pain. Other treatments include application of warm water gauze and topical 2% nitroglycerin paste to stimulate quick vasodilation and restore blood supply. Also sublingual aspirin to undo the clotting, and extreme cases of low molecular weight heparin and prostaglandin E1. So this is a blockage of the artery because of the injection of this hyaluronic acid was into the artery itself, causing that triangular pattern, because once the artery is occluded, the whole distribution of the blood flow to that area gets involved. So imagine the artery was in the lower lip, and then it supplied the blood flow to all this area. So all that area became involved. You can inject the antidote, if you will, hyaluronidase. It's a breakup of hyaluronic acid into the area. You can use aspirin, you can use blood thinners, and ultimately you might need some surgery and stuff like that to undo what was done. It is a rare event, but because more and more people are having injections, and most of these injections are using hyaluronic acid, then it's happening more and more. It is a dermatologic emergency. Pain, discomfort, disproportionate to the findings present, and informs a libido pattern. You should watch my video on libido reticularis and the violations discoloration. So very interesting case, something I've never seen before, and certainly good to know. Some things you can do to start the treatment while you're working on the surgeon. You can use some warm gauzes over it. You can use some topical nitroglycerin, and you can give patient an aspirin, maybe even put patient on blood thinners or prostaglandin E1. I hope you learned in this case. Obviously, you learned something that can happen from a seamless, innocuous, or very minor procedure, which is the injection of hyaluronic acid into the skin for the process of soft tissue augmentation and lip making them bigger, or whatever it is that ladies want to do with that, and causes a reticulated area of vertical distribution and pustules, and obviously needs plastic surgery consultation and the diagnosis of vascular occlusion secondary to that. I hope you learned during this case. I hope you learned about what BAFFORD means, badass ER doctors. That's an inside secret I'm sharing with you today. And hyaluronic acid injections, a potential complication of arterial occlusion, the treatment with hyaluronidase, and plastic emergency consult, because it is a dermatologic emergency. Again, we'll be posting other clinical cases and videos, so stay tuned to this channel for more. Bye-bye.